Hello, I'm Scott Roloff, President of IntegerHealth Technologies. At IntegerHealth, we do something that no one else does. We quantify healthcare outcomes, put a dollar and cent value on each one. This program shows how we do that for wellness programs. Every employer has wellness programs. These employers know what they spend to the penny on these programs. They have no idea what they get in return for those dollars. The vendors of the programs have promised fantastic results based upon the metrics that the vendors themselves will measure and shovel back to the employer. But in baseball, we don't allow the pitcher to call balls and strikes. At IntegerHealth, we quantify the results of a wellness program in dollars and cents and calculate the program's ROI, or return on investment, so that employers will know whether their program is working, and if not, what to do about it. Let me show you how.
Think of our analytics as an engine, a series of algorithms and groupers. We need fuel for that engine. That fuel, the inputs, will be the medical and pharmacy claims under the employer's health plan, the employer's human resource attendance and payroll records, and the enrollment and cost of the wellness program. The engine analyzes these inputs and quantifies the wellness program's results. That output is the decrease, if any, in the medical and pharmacy claims of the employees participating in the program, plus the decrease in their absence costs related to those claims, the value of the time that they missed because they were out sick. Once you have that number, it's just math to calculate the return on investment. Now, the program's vendor will give you various qualitative measures to convince you that their program is working. For example, if you have a walking program, they'll show you how the number of steps have gone up. Or if you have a diabetes management program, how the A1C scores have gone down. These aren't bad things, but let's remember the purpose of a wellness program. It's to keep employees well. Why? 2 reasons, and only 2. First, employers pay most of the healthcare expenses for their employees, and sick employees cost more than well ones. Second, sick employees miss more work because they're sick. So the return on a wellness program is the decrease in the medical and pharmacy claims of the participating employees, plus the decrease in their medically related absence costs. Anything else is just fluff. If the steps went up, or the A1C scores went down, the assumption is that the employees are healthier. And if they're healthier, the assumption is that their healthcare costs and medically related absence costs went down. Why assume anything? Just measure the actual decrease in those costs. When the analytics engine sifts through all this data, there will be 2 important byproducts. First, a list of employees not participating in a program who should be. Say the engine goes through the claims and identifies 500 employees who have diabetes, but only 200 of those employees are participating in your diabetes management program. Now you can have the case managers at your health plan call the other 300 and encourage them to participate too. The second byproduct will be a list of wellness programs that the employer should have, but doesn't. For example, when going through the claims, the engine may identify a significant number of obese employees. In that case, if the employer doesn't have a weight reduction program, it would want to consider starting one. So how do we calculate the program's return on investment, or ROI? We already know what the program cost. Now we know what we got for that money. The decrease in the medical and pharmacy claims for the participating employees, plus the decrease in their absence costs related to those claims. Subtract the cost of the program, and that's our return. Divide that return by the cost, and that's our return on investment. So what claims, and by extension absence costs, do we use? It depends on the type of the program, and there are 3. general wellness programs for everyone, such as walking and weight reduction programs, disease management programs for employees with specific chronic conditions, such as diabetes and obesity, and employee assistance programs, or EAPs, for employees with behavioral health issues. One side note: remember that a byproduct of these analytics will be a list of employees not participating in a program who should be. Because of their sensitive nature, there will be no such list for EAPs. It's one thing to have a case manager call an employee with diabetes about joining the diabetes management program. It's quite another to call an employee with depression and encourage them to join an EAP. Now back to what claims and related absence costs to use. If you're looking at a general wellness program, you can use all the claims or filter them, and use only those concerning chronic conditions, casting aside the claims on episodic ones. Chronic conditions are things that never or seldom go away, like diabetes, while episodic ones have a beginning and an end, like a broken arm. And when evaluating a disease management program, you can include the claims for all the chronic conditions, or filter them again, and look at only those for the specific chronic condition that the wellness program addresses. For these purposes, you can think of EAPs for behavioral health issues as a specific type of disease management program. Instead of treating diabetes, they may treat depression. And you don't have to do one or the other, but can look at the wellness program's impact under all these scenarios. If you'd like more details, you can read the article that we wrote on how to do this in the peer-reviewed Journal of Total Rewards, or you can call us.
That's how we quantify the results of a wellness program and calculate its ROI. If you're interested in how we could do that for you, I'd love to talk. My contact information follows.